Hey, my name is Jason Zeleny, and I just wanted to thank you for taking the time to learn more about what we do here at the Golisano Center for Special Needs, and more specifically, our pediatric feeding program. So, at our center, we're dedicated to transforming the lives of children with severe feeding disorders, essentially trying to help them achieve more independence, better health, and an improved quality of life. Many children with feeding difficulties struggle with sensory aversions, oral motor deficits, and behavioral challenges that prevent them from consuming a more balanced diet. And without proper intervention, these challenges can lead to long term nutritional deficiencies, developmental delays, and significant stress for families. And that's where we come in. So, our intensive behavioral feeding program provides evidence based treatment using applied behavior analysis, or ABA, to help children expand their diets, tolerate new foods, and develop, for example, self feeding skills. Each child undergoes a comprehensive assessment before they begin working with us. And then once they're admitted, we created an individualized treatment plan that's tailored to their needs. Our multidisciplinary approach involves feeding specialists, psychologists, medical professionals, and speech language pathologists and or occupational therapists. And we're all working together to address their physical, behavioral, and emotional aspects of feeding disorders. Over the course of treatment, children learn to consume a variety of different nutritious foods that they otherwise would not consume previously, and to reduce mealtime resistance or refusal behaviors while trying to teach them how to enjoy meals in more social settings without distress. And the results speak for themselves. Families who once feared their child might remain dependent on really restrictive diets or tube feedings, for example, see dramatic improvements with their children consuming more balanced diets or meals and participating in meal times without as much anxiety. So, a little bit about the grant proposal. Despite that our proven successes as a program, one of the biggest challenges that we face is ensuring that children receive the right level of care at the right time. Many children with feeding disorders are either referred too late or prematurely sent to an intensive treatment program when less intensive interventions might be a more appropriate place for them to start. To address this, our grant proposal aims to improve early identification, to streamline referrals, and provide training for first point of contact professionals such as pediatricians or other healthcare professionals. Our goals are to increase appropriate referrals to our intensive feeding program, to reduce premature referrals through better education and outreach, to equip healthcare providers with tools to identify feeding disorders and match children with the right treatment earlier, and improve early intervention so that children get the help they need sooner. Through provider education and community outreach, we hope to raise more awareness about pediatric feeding disorders, to also reduce treatment delays, and ultimately help more children with feeding disorders gain independence and to thrive. So, in closing, we're very excited about this potential project. With the right training and the right education, I believe more children can receive timely, effective treatment, which can lead to better health outcomes and greater support for families. Thank you again for your time and for your commitment to improving the care for others in the community. Together, we can make meaningful differences in these children's lives. Thank you.